Trauma can cause weight gain through a number of different mechanisms. Here are a few ways that trauma can contribute to weight gain. Changes in stress hormones. Traumatic experiences can trigger the release of stress hormones such as cortisol and adrenaline. These hormones can increase appetite, particularly for high-calorie, high-fat foods, and can also slow down metabolism. Over time, this can lead to weight gain. Coping mechanisms. People who have experienced trauma may turn to food as a way to cope with their emotions or to numb themselves from painful feelings. This can lead to overeating and weight gain. Disrupted sleep. Trauma can disrupt sleep patterns, leading to sleep deprivation or insomnia. Lack of sleep can affect hormones that regulate appetite and metabolism, leading to weight gain. Negative body image. Trauma can also contribute to negative body image, which can lead to disordered eating behaviors or a lack of motivation to exercise. This can contribute to weight gain or difficulty losing weight. Medications. Some medications used to treat trauma-related conditions such as depression or anxiety can have weight gain as a side effect. Reduced physical activity. Trauma can also lead to a decrease in physical activity. Some trauma survivors may become more sedentary or avoid exercise as a way to cope with feelings of anxiety or depression. This can lead to weight gain over time. Substance use. Trauma can increase the risk of substance use disorders, including alcohol or drug addiction. Substance use can contribute to weight gain through the consumption of high-calorie, high-fat foods, and can also affect metabolism and appetite regulation. Learned behaviors. People who have experienced trauma may have learned unhealthy eating behaviors or coping mechanisms from their families or caregivers. For example, if a parent or caregiver used food as a way to comfort or soothe a child who experienced trauma, that child may be more likely to turn to food for comfort as an adult. Post-traumatic stress disorder, PTSD. People with PTSD may experience hyperarousal, which can lead to an increase in heart rate and blood pressure. This can cause the body to burn more calories at rest, leading to weight loss. However, some people with PTSD may also experience hypervigilance or avoidance, which can contribute to weight gain. Impact on hormones. Trauma can affect the body's hormonal balance, which can contribute to weight gain. For example, trauma can disrupt the thyroid gland, which plays a key role in metabolism. Trauma can also affect sex hormones, which can impact weight distribution. Emotional eating. Trauma can trigger emotional eating, which is when people turn to food to cope with negative emotions. Emotional eating can lead to overeating and weight gain. Lack of control. Trauma survivors may experience feelings of powerlessness or lack of control, which can lead to unhealthy eating habits. For example, some trauma survivors may feel like they have no control over their trauma history, but they may feel like they can control their eating habits. Depression and anxiety. Trauma survivors are at increased risk for depression and anxiety, which can affect eating habits and lead to weight gain. Depression can cause people to lose interest in food or overeat, while anxiety can trigger emotional eating and cravings for high-calorie, high-fat foods. It's important to note that trauma can affect different people in different ways, and not all trauma survivors will experience weight gain. However, for some people, trauma can be a contributing factor in weight gain or difficulty losing weight. Seeking support from a mental health professional can be helpful in addressing trauma-related issues and developing healthier habits for weight management. Did you enjoy the video? Let me know in the comments below what you thought and if there are any other topics you'd like me to cover. If you like what you're seeing, please subscribe and hit the like button. Your support helps me create more great content. Thanks for watching.